Well, managing pain can be just overwhelming for some people, even after they try medications and other therapies. But there are a lot of options out there these days, including music therapy, aromatherapy, pet therapy, all of that to help relieve chronic pain and anxiety. And Katrinia Kraemer is here, registered nurse and director of the Acute Pain Service at University Health System. And there are all kinds of different therapies that you are using now, University Health System, University Hospital, and you're a fairly new, it's a new service, right?
Well, the Acute Pain Service has been around for over 10 years at University Health System. The new part of it, though, for the last couple years, we're bringing in more integrative type therapies and modalities to help people with pain.
And what are some of those?
Some of those that we're currently using are energy healing therapies like Reiki and pranic. We're also using aromatherapy specifically for post-operative pain and anxiety, as well as nausea and vomiting. We're using pet therapy in the hospital. We have child life specialists who are also working using music and art as part of the healing process for patients that are suffering with pain.
And some people might hear this and go, well, that's kind of, I don't know, I haven't heard of this. Is that really medicinally science-based? And what do you tell them?
There is a lot of science behind it. Most large hospitals across the United States are now using many of these modalities. It's very, very effective with oncology patients, surgical patients, as well as trauma patients, which is what we see a lot of at University Health System.
And with so many of these therapies, how do you choose from between all of those?
We talk to the patients and see what they might be interested in. A lot of them have already tried many of these modalities on their own before they ever became a patient.
And you talked about 100 million Americans have some kind of chronic pain?
That's the statistics from 2011, so you know it's probably even higher now.
And we see pets here, and a lot of people realize that that helps. Are some of the things that you work with in the hospital that you train people to deal with once they get out of the hospital?
Right. We try to teach them coping skills. A lot of times patients come into our hospital, they've just been in a terrible trauma. Maybe they've never had to experience pain before until that moment, and so they may not have real good coping skills to deal with it. So we go in, we work with them with deep breathing, with relaxation, meditation, guided imagery, all of these things, and they're very research soundly based.
And pranic, finally pranic and Reiki, I've never heard of that.
Reiki, those
Reiki.
are both energy modalities that have been around for thousands of years from the Eastern type of medicine.
Does that have to do with your chakras?
It does, your chakras and auras. That's right, and there's a lot of research being done with that, and it's really shown to be quite effective, and many hospitals are using these types of practitioners to help their patients.
And people can get more information with the University Health System at the Acute Pain Service, not
Correct.
Center. Okay. Well,
Correct.
thank you very much. Katrinia Kraemer, thank you very much for coming in.
Thank you.
Appreciate it. Delane?